what childhood diarrhea is and how to manage and prevent it. Childhood diarrhea is a common health issue characterized by frequent passing of loose or watery stools within a certain period of time. Diarrhea is particularly common in developing countries and is usually caused by factors such as viral infections, bacterial infections, food poisoning, antibiotic use, food intolerance, or malnutrition. The causes of diarrhea can be diverse. Among them, viral infections, especially rotavirus, are one of the most common causes. Other common pathogens include bacteria such as Salmonella, Shigella, and Campylobacter. Additionally, parasitic infections such as Giardia, lamblia, and Cryptosporidium can also lead to diarrhea. Food poisoning can occur through the ingestion of contaminated food or water. Antibiotic use can disrupt the normal gut flora, leading to diarrhea. Some children may experience diarrhea due to food intolerance, such as lactose intolerance. Furthermore, malnourished children are more prone to diarrhea. The symptoms of diarrhea include frequent loose or watery stools, abdominal pain, vomiting, nausea, and signs of dehydration. Mild diarrhea may last only a few days, while severe or persistent diarrhea may take longer to resolve. Acute diarrhea and chronic diarrhea are two different types of diarrhea, and they differ in the following aspects. 1. Duration. Acute diarrhea refers to diarrhea symptoms that occur and last for no more than 2 weeks, typically resolving within a few days. Chronic diarrhea refers to diarrhea symptoms that persist for more than 4 weeks, which may last for months or even longer. 2. Causes and factors. Acute diarrhea. Common causes include viral infections, such as rotavirus, norovirus, bacterial infections, such as Salmonella, Shigella, or food poisoning. It is usually caused by short-term infections or exposure. Chronic diarrhea. Chronic diarrhea may have various underlying causes, including chronic infections, intestinal inflammation, gastrointestinal diseases, such as Crohn's disease, ulcerative colitis, food intolerance, or allergies. 3. Severity of symptoms. Acute diarrhea. Symptoms are typically more pronounced, including frequent loose or watery stools, abdominal pain, vomiting, and nausea. However, most cases of acute diarrhea resolve on their own within a few days without special treatment. Chronic diarrhea. Symptoms of chronic diarrhea may be milder or gradually worsen, but not as severe as acute diarrhea. Symptoms may include frequent bowel movements, abdominal pain, indigestion, malabsorption, etc. 4. Treatment and management. Acute diarrhea. In general, acute diarrhea does not require specific treatment. It is important to maintain proper fluid and electrolyte balance by drinking adequate fluids and using oral rehydration salts, ORS, to prevent dehydration. Most cases of acute diarrhea resolve on their own within a few days. Chronic diarrhea. Due to the diverse underlying causes of chronic diarrhea, treatment methods may vary depending on individual circumstances. Further diagnosis and tests, such as laboratory examinations, endoscopic examinations, or imaging studies, may be needed to determine the cause and develop an appropriate treatment plan. Treatment methods may include medication for underlying conditions, dietary adjustments, nutritional supplementation, management of malabsorption, etc. Good hygiene practices are essential for preventing diarrhea. Regular hand washing, especially after handling food and using the toilet, can effectively prevent the spread of pathogens. Additionally, vaccination against rotavirus is an important measure in reducing the occurrence of severe diarrhea. Traditional Chinese medicine, TCM, also plays a role in the treatment of diarrhea. TCM emphasizes holistic regulation and balance, using different methods and herbal remedies based on the specific symptoms and underlying causes of diarrhea. Here are some commonly used methods and herbal remedies in TCM for treating diarrhea. 1. Herbal remedies. TCM practitioners may formulate herbal decoctions or granules based on the causes and symptoms of diarrhea to regulate and balance yin, yang, qi, and blood in the body. 2. Regulation of the spleen and stomach. According to TCM theory, imbalances in the spleen and stomach functions are often related to diarrhea. TCM can stimulate specific acupuncture points to regulate and enhance the functions of the spleen and stomach, improving digestion and absorption and reducing the occurrence of diarrhea. 3. Antidiarrheal herbs. TCM has certain herbs with astringent and antidiarrheal properties, which can be used for the treatment of acute diarrhea. 4. Intestinal regulation. For chronic diarrhea or patients with intestinal functional disorders, TCM can regulate intestinal functions, improve peristalsis, and enhance intestinal absorption function. Acupuncture is a therapeutic technique in traditional Chinese medicine that involves stimulating specific acupoints to adjust the body's functions and balance yin and yang, qi, and blood, thereby treating and preventing diseases. Acupuncture is widely used in the treatment of diarrhea, but it should be performed under the guidance of a professional TCM practitioner. Acupoints and treatment courses are chosen based on individual conditions and the principles of TCM diagnosis and treatment. Additionally, the cause and severity of diarrhea can also influence the application of acupuncture. For acute diarrhea, acupuncture may not be the preferred treatment method, and oral rehydration and medication play a more important role. On the other hand, acupuncture may be used as an adjunctive therapy for chronic diarrhea or diarrhea associated with spleen and stomach imbalances. In summary, acupuncture has a certain role in the treatment of diarrhea by regulating intestinal peristalsis, adjusting spleen and stomach functions, modulating the immune system, and alleviating symptoms. However, acupuncture treatment should be conducted under the guidance of a professional TCM practitioner and combined with other treatment methods to achieve optimal results. If your child experiences persistent or severe symptoms of diarrhea, please consult healthcare professionals for accurate diagnosis and treatment advice. Thank you for watching, and don't forget to subscribe.